Hi everyone, my name is Claire. I'm a second year nursing student and today I'm going to give you an introduction to working as a nurse in Ireland. Stay tuned to find out more. So the first thing I'm going to talk about today is the HSE, which is Health Service Executive. This is the Irish health system. It was established in 2004 under the Health Act. The HSE is responsible for the management and delivery of health and social services for everyone who needs it across the Republic of Ireland. Their values include care, compassion, trust and education. Next, I'm going to talk about the types of nursing in Ireland. So general nursing, psychiatric nursing, intellectual disability nursing, children's nursing, and then we also have the integrated programme which is currently available in Trinity College Dublin, which is children and general nursing, an integrated 4.5-year course. At the end of this programme you'll be a qualified children's nurse and an adult nurse. So this is a really good programme to go for if you aren't sure whether you want to be a children's or an adult's nurse, and then you get to decide at the end of your course and you also have the best of both worlds because you've both qualifications. Regarding further education after you get your nursing degree, there is the opportunity in Ireland to do a PostGrad. So this is a diploma in nursing. These courses take 1 year in most universities and you can complete them in areas such as critical care, oncology and cardiac. This will further your job opportunities and enable you to get higher paid jobs and a higher range of job opportunities within specific areas that you qualify in. What is the role of a nurse? The primary role of a nurse is to be the advocate for the patient who is unwell and to take care of them to the best of your ability. Nursing offers you to be able to make a big change to somebody's life. The main advantages of nursing include job flexibility, career opportunities, because there's often more career opportunities than just being a staff nurse, as we'll get on to later, so stay tuned for that. Always the opportunity to travel with nursing. As my dad likes to say, it's a passport to the world. Job stability, maternity plans are really good. It's a vocational job, so you get great fulfillment from helping people every single day. There's currently over 65,000 nurses in Ireland at the moment. Although in recent years there has been many nurses emigrating to places such as Australia for a better work-life balance. Although I personally think Ireland is a great place to be a nurse and I certainly would love to be a nurse in Ireland someday. The average salary for a nurse currently in Ireland is €38,000 a year. This is affected by your years of experience, your job role, whereabouts you work. For instance, if you work in Dublin, you might get paid more than if you work in Limerick or Laois or anywhere else, but it depends on where you work. Also, if you're in a speciality role, you're more likely to get paid higher. Also, if you're in a nurse practitioner role, then you're more likely to be on a higher salary than just a staff nurse. All nurses and midwives who practice in Ireland by law must be kept on the register, which is maintained by the Nursing and Midwifery Board of Ireland, which is known as the NNBI. Each year it is necessary to pay an annual retention fee. This is known as the A or F. It is really important to keep your Irish nursing registration in check. All nurses and midwives who practice in Ireland by law are to be kept on the Irish Nursing and Midwifery Council register. Every year you will receive a reminder in the post or by email telling you to renew this. If you do not pay your annual retention fee, your A or F, by 28 days after receiving this reminder, you will be unable to work as a midwife or nurse in Ireland until you are put back on the register. This is a big consequence for not paying just €100 per year. So I would recommend everyone to pay that in time so that does not happen. A or F in 2018 was €100. It does depend on the year how much it costs, and also if you are earning more in your job post such as a nurse practitioner, then you will have to pay slightly more. Many people are unaware the opportunities that nursing can bring. Before I started nursing, I was completely unaware of the different roles available to people who train to be a nurse. Of course, everyone knows the staff nurse role, which is the typical role that most people go to straight after qualifying to give them experience and to gain understanding about the place they're working in. There's also such roles as the nurse practitioner, which now they are called the ANP, which is Advanced Nurse Practitioner. There also is the CNS, which is Clinical Nurse Specialist. These are nurses that specialise in a particular area and they are the expertise in that area. There's education roles available for people who want to work in universities and colleges, providing education about nursing, and they will go back to university maybe and do more educational degrees. There's also the opportunity to be student mentors. So for students who are on placement, there's the opportunity to be a mentor to a student. There's more management roles, such as being a sister of a ward or a ward sister. These will be in charge of the ward and more dealing with the managerial side of the role of nursing and less ward-based. There is also the chance to be a matron, which oversees a few wards, and they're kind of the head of the department and they liaise with the sisters and the ward sisters as well. There's also the nurse prescriber role, which can prescribe medicines to patients, and they can see patients in clinic settings just like a doctor can. There's many different settings nurses can work in, such as hospital, care home, nursing home, the community, going to people's homes, the GP, schools, the army, and sexual health clinics, just to name a few. There's many good attributes that are needed if you want to be a really good nurse, but I would recommend some of these to be the most important. Being a good listener is so important because you have to listen to what patients have to say, and sometimes our job as a nurse is a very detective role. You're listening to what they have to say and you need to pick up on the slightest things because patient won't say things more than once. If you like meeting new people, then it's a perfect role for you because you're meeting new people every single day of the week and it's a very sociable role. It's also great if you're a good communicator because you're constantly talking with patients, liaising with doctors, other nurses, the sister, OTs, physios, you name it, you talk to. If you want to make a difference to society, nursing is a great role to be able to do that in. You can see the difference you make to a patient within a few days. They could be going from bedbound to being able to walk again after an operation. This is really, really nice to see, and you really feel like you've made a difference to somebody's life. Committed to lifelong learning. As a nurse, you're constantly learning. It doesn't matter how many years of experience you have, every single day is a new learning opportunity. So if you're somebody who loves to learn, then nursing's great for you. If you are approachable. As a nurse, I feel like it's really important to be able to be approachable. If patients are scared of you, then that's not very good. So it's really nice for patients to be able to tell you things and for them to think that you're approachable. Also, if you like to assist people to keep independent and to help people live healthy lives. So to conclude with what I've said, you might be saying, why nursing? But I think it's an amazing job to help assist people in everyday life get better and live a more fulfilled and independent life. And you can help somebody do that. Every single day, you will return home and feel fulfilled with the work you have done. Not many jobs can say that. So I hope this was a good overview of being a nurse in Ireland. And if you have any questions, leave them in the comments. Thank you so much for listening, guys. Hope to see you again soon. Bye!